The challenges faced by Nigeria's healthcare sector, including the brain drain of medical personnel and the poor state of hospitals, are indeed significant issues. These challenges have far-reaching implications for the quality and accessibility of healthcare services in the country. Addressing these concerns is crucial for the well-being of Nigerian citizens and the overall development of the nation. Investing in healthcare infrastructure, equipment, and technology is essential to upgrade the quality of healthcare available in Nigerian hospitals. And of course, joining me right now on the news is Dr. Jumoke. She is a public health physician. Thank you so much for your time, Dr. Jumoke.
You're welcome. Thank you.
All right, can you provide some sort of insight into the extent and impact of the brain drain, particularly among medical personnel in Nigeria? And now, of course, it has affected the healthcare system.
Right. Thanks, Dapo. Right now, we're at a precarious situation. It's not looking very nice. An article in December said about 50% of registered medical practitioners were not practicing within the country. So we really don't know where it's at right now, but it's not at a good place. Now, when medical doctors finish school, the next thing they do is find their way out. They're writing PLAB, they're writing USMLE. When we finished school, some people left, some stayed behind. Later on, some started leaving. But the way it is now, about 60, 70, sometimes even as high as 80% of the doctors that graduate are on their way out. They're already planning on leaving within the next year or two of graduation.
Immediate
So
reasons.
it's not
Okay.
encouraging.
Okay, great. I mean, it's really, really disturbing when you hear figures like that. But let's also look at the both primary and, of course, secondary reasons behind the emigration of healthcare professionals from Nigeria, and how can the country work to actually address the root causes?
The root causes are obvious for all to see, really. There's the problem of infrastructure. The infrastructure in a lot of public hospitals is run down. Now, when you think about the fact that almost 65% or more of healthcare is from the public sector, and then healthcare is actually quite expensive. It's expensive to get the equipment. It's expensive to get trained workers. It's expensive to get the reagents for the labs. It's expensive to run a hospital, to run all the departments under it. So it's not very many people that can have a private setting that has everything in place. And usually those are tertiary hospitals. So you have poor work conditions, you have poor pay, lack of infrastructure, lack of technology. Not all hospitals have started using electronic medical records. Not everybody working in the public sector can boast that, oh, they are computer proficient. So there are so many factors. And of course, work overload results in a lot of burnout and lack of job satisfaction. So it's not very easy. And then if we want to talk about welfare, a lot of times the strikes that come back to back are as a result of issues with doctors' welfare. This cuts across not just doctors, nurses, the whole healthcare sector.
All right. I mean, are there strategies or policies you believe that would be effective in encouraging Nigerian medical professionals, both home, and abroad, particularly those abroad, to return home and contribute to the healthcare system and its improvement?
Now, the fact about the people abroad coming back, well, that's a long shot. It actually depends on individuals. Over the years, there's some people that have practically cut ties with home, but there are also some colleagues I have that are really in tune. From time to time, they come back to Nigeria. They have these community outreaches. They go back to their home of origin, their states of origin. Some come and have surgical outreaches. You have that all over the country from time to time. So you know those whose hearts are at home, but there's some people that have been so jaded, they've been cut off. But I would always advocate that prevention is better than cure. So we actually have to start from the beginning, from the root, from the medical students. What package, what do they see with their resident doctors, with the specialists? How do they see the system? Is the system open to them? What's the welfare package like? How are they working? How are they being compensated? So I would prefer we start with those here. Now, getting people that have left the country, that have gone to a country where they don't have issues with light, they have good roads, they have good infrastructure, they have a good welfare package, they have political security and stability where they can plan themselves. That will depend on individuals. But I'll prefer we start working with the young doctors. We start working with those that are already in the public healthcare system so they don't get jaded. Right now, it's so bad. Some resident doctors who are planning, who are having their residency program, they're also leaving. So you have several consultants and you have some resident doctors in the system, and then suddenly they even leave without finishing. They are ready to go to another country and start all over again.
All right.
So
I mean, I'm sorry to,
people
of course, interject, Dr. Jumoke, but because you pressed the time, I just want to quickly know, is it possible to give us in detail, you talked about welfare, in detail, how much does an average doctor, say maybe, those in housemanship, those are, that are advanced, in the profession, how much do they earn in terms of salary and also, allowance and packages compared to what, is being paid abroad? And what can be done in terms of collaboration to ensure that the healthcare system home is better in less than 60 seconds?
Okay, I will always say you can't compare Nigerian salary to a UK or US salary. You earn in Naira, you pay your bills in Naira. You earn in pounds, you pay your bills in pounds. And we know how the exchange rate is. So what you have in January is different in December. But with welfare, at least with collaboration, there should be more avenue for trainings for doctors. That has always been the case for many years, but the opportunities are dwindling over time. So if doctors know they have an opportunity to train and get the required skills and come back, and when they get back to the country, there's the infrastructure, the technology, the equipment to practice what they learned, that would help, rather than coming back and then some of the equipment are not even available. And then there should be a very buoyant welfare package, especially as so many people are leaving that the people left behind are being overburdened. There has to be adequate employment. So you have a 1-for-1. You have 5 doctors, 3 leave, you get replaced with 3. Not that you leave 2 people working the same job for a prolonged amount of time on the premise that you can't afford to employ, but you employed 5 before, so you should be able to keep that 5 as 5. And there's so many doctors wanting to get into the public health care system, but they're being told there's no space. But the people there are overworked, so there should be a bit more space for more doctors to be absorbed into the system. So it lessens the workload and helps people to work to their full potential without being burnt out.
All right, thank you so much for your time, Dr. Jumoke Oke, a public health physician. Thank you once again.